the country and other parts of the world. We have still had a tragic number of hospitalizations, a tragic number of people sick with COVID-19, and a tragic number of deaths. But we are better positioned to come out of this because of the early decisions we've made and because of our community's commitment to stopping the spread of COVID-19 in our community. In order to ease our safety restrictions in our community, we need to see the data. Hospitalizations need to be coming down, the hospital admissions need to be coming down, and the ICU admissions need to be coming down. In addition, we need to have a robust testing environment. We need to be able to test everyone who's asymptomatic, and in congregated living centers, nursing homes, and other high-risk areas, we also need to be able to test everyone who is high risk of exposure or who is asymptomatic. Other parts of the state of Missouri have a different setting, a different situation than we do here in St. Louis County and in the St. Louis region, and that's why we're moving at a different pace. We understand that the governor's stay-at-home order will be partially lifted with restrictions today. St. Louis County is not ready to do that yet, but we're watching very closely. We'll continue to watch the data, and we'll watch and wait and see what the response was to the county's bid process and requests for people to sell us more testing supplies. And that bid process will close at 5 o'clock tonight. That's an important variable in our determination of how we move forward. We've always had a target of mid-May. I spoke to Mayor Cruzan this morning and last week. We both have a target of mid-May, but neither one of us are prepared to settle on any specific date yet. Our decision will be data-driven, and we'll be watching very closely Dr. Garza's report this afternoon of how the hospitals have done over the weekend. Moving forward, we still have to maintain the things that have put us in the position to be successful and start to ease and continue to have this conversation about easing some of our safety orders. That means social distancing, stay 6 feet away from others, avoid large crowds, wear a mask when you're out in public, especially in areas where social distancing is going to be difficult. And I'd be glad to answer questions.
Go ahead. Dr. You alluded to it there, and you alluded to it last week, but I'm just wondering, is there something specific about the St. Louis County situation that makes this a longer process than the rest of the state of Missouri? Is it just the number of cases? What in your mind is the key holdback here?
Well, certainly the number of cases. We have 65% of the cases in the state of Missouri are here in St. Louis County. We still have a significant number of our tests that are positive. We still have a significant prevalence of the virus in our community. We understand that our social distancing and stay-at-home orders have suppressed the viral activity, but we're not where we need to be yet. We do believe that we are trending in the right direction. We've watched the reports last week. It appears that we've reached the peak. We need to see this trending down, and we need to see it continuing to trend down, and we need to have an adequate and robust testing environment. It's clear that St. Louis County has been hit harder than the rest of the state. The governor recognizes that the metropolitan regions have been harder than the rest of the state, and all metropolitan regions in our country have been hit harder than the rest of the country. And if you look at how social distancing orders have been held in place, how they've been weakened or eased in other parts of the country, we still have more challenges in our metropolitan regions. But we do believe that the trend is in the right direction. We do believe that this week is the time to have the conversation of what that might look like, and we will give our businesses guidance on social distancing. We intend for that guidance to be very similar in the city of St. Louis and in St. Louis County, and our staff are working together with our business leaders, with our public health leaders, to determine what that guidance would look like. And we hope to be able to share that guidance when we're ready to make a decision about what the proper date will be, what the right date would be, and that will be a data-driven decision. based on what we see in our hospital systems and advice from our public health experts.
How concerned are you with these other surrounding counties partially reopening today, St. Charles County, Jefferson, Franklin? Is there a concern there about perhaps cases here upticking from more people being out and about there and traveling around? What's your thought on the reopenings around us but not here?
Well, you saw over the weekend that at the federal level, the White House has revised their estimates of the impact of COVID-19 on our country and the loss of life that could be associated with this virus. And they've revised that based on by the weakening of social distancing restrictions in our country. We know that when we ease our restrictions, that the virus will spread in our community. It has to spread at a rate that is controlled, and we have to be able to provide medical care for the people that are infected. We have to identify them quickly. We have to get them the advice that they need, medical treatment if they need it, and we have to find the folks that they have become in contact with. That's why contact tracing is so important. We need testing, isolation, and contact tracing. And St. Louis County is in the process of hiring another 100 people to manage the contact tracing piece, and we expect that we'll be hiring more over the rest of the year, and we'll maintain that workforce into 2021 because that will be an important part of the recovery. So we know that the virus will spread in our community when we ease our social distancing restrictions, but we also know that at some point we have to do that. We have to do that when it's safe and when it's responsible and when it's thoughtful. That means the curve has to be coming down. Our hospitals have to have the capacity to manage our patients who are sick. We have to have protective equipment in our hospitals. We have to have a good testing environment, and we have to have the ability to advise people who test positive and find people who have come in contact with them and advise them as well.
With those counties reopening, then could that set back our reopening if the infections start crossing county lines into St. Louis County?
No, I believe that St. Louis County can make a decision on reopening based on St. Louis County data. That what's happening in the region around us will impact us some, but the biggest impact will be our decision will be made mostly on what's happening right here in St. Louis County and St. Louis City.
Last week you had said that you thought maybe late this week you'd have a specific timeline. Is
Yes.
that still kind of?
Yes, I spoke to Mayor Cruz this morning and last week, and our goal is to have a timeline by midweek with guidance for businesses as well. But it's too early today to pick a date and start building around that date. We really need to see the reports from Dr. Garza over the weekend and make sure that we're continuing to trend in the right direction.
Timeline by midweek for reopen.
Timeline for a decision to reopen by midweek.
Okay.
Yes.
So that would include a date, I'm assuming, to
Yes.
reopen. Okay.
Include a date
Okay.
and a plan.
Okay.
Yes.
Hey,
But
Sammy.
that needs to be made together with the public health officials, with our health systems, and with the city of St. Louis.
I'm sorry, we have a question from Channel 5. It's similar to what Chris has said. With Missouri starting its reopening plan today and neighboring counties like St. Charles County starting to reopen businesses, what message do you have to St. Louis County residents who may be tempted to go to other counties that are open and then come back to their homes in St. Louis County?
Well, I think we have to recognize that St. Louis County is still greatly impacted, and that our reopening strategy and our reopening timeline depends on our residents complying with the social distancing orders. And we understand that this is frustrating, and we understand that other jurisdictions will have different timelines. But it's very important that the people who live and work and are in St. Louis County, that they respect the social distancing guidelines that are in place here. That's what helps control the spread of the virus. That's what's helped get us where we are today, and that's what will help keep us on the timeline. Our success moving forward in the next year will depend on decisions that individuals make. We can't depend on someone else to make the right decision about social distancing. This is a decision that we all own. And if we do this together, if we stay on the timeline that works for St. Louis City and St. Louis County, then we'll move forward together.
Sam, I understand there's no specifics yet, but are you still thinking mid-May is a good?
Yeah, mid-May's always been our target. It was our target with the hopes that our social distancing measures will continue to take us in the right direction. We've been fortunate here in St. Louis County that we've had good compliance with social distancing measures. It's been tough for a lot of people. It's been tough for a lot of businesses, but it's gotten us to where we are today, and it's allowed us to fare better than the rest of the country, even though we were hit much harder than the rest of the state, like any other metropolitan region would be. So we just need to stay on this timeline.
You good? All right, thank you.
Okay, thank you.
There you are. Good. Yeah, got you the right thing this time.
Yeah.
Good morning, everyone. As we begin a new month in St. Louis County, we hope that May is a month that we can continue our discussion about a gradual reopening of St. Louis County. By the end of next week, I'll certainly have more information in that regard. We're having those discussions now among our regional leaders. Governor Parson has announced that he will lift the stay-at-home order in the state of Missouri with some additional restrictions starting on May 4th. And I understand that other areas of the state, other counties who are not as impacted as St. Louis County, will be following the governor's plan. He has also made it clear to us that St. Louis County is not like the rest of the state, and he understands that local leaders here may be on a different timetable. St. Louis County is not ready to release its safety orders and stay-at-home restrictions, although we are in discussions of that timeline right now. St. Louis County has over 40% of the positive COVID-19 cases in the state. We still have a lot of people who are very sick in our hospitals. I know this process has kept a tight grip on our economy, and I understand the impacts nationally and here in our region have been devastating. We understand that, and we're going to move through that. Today, in response to that, I'm pleased to announce our St. Louis County Cares Small Business Relief Program. This SBR program will focus on economic relief to the businesses that have been most impacted by the stay-at-home orders and the epidemic. This grant can be used to pay the cost of business interruption or reopening costs to become in compliance with new social distancing guidelines and to get these businesses open again and contributing to our economy. So again, the business interruption costs can include any fixed costs, utilities, or costs associated with social distancing changes in the place of employment. Businesses eligible for an SBR grant include nonprofits, sole proprietorship, for-profits, anyone who has any business that has a place in St. Louis County as its principal place of business, 50 or fewer full-time employees as of March 1st. These guidelines were based on preliminary research by the Federal Reserve Bank of St. Louis, which has shown us that the businesses most impacted by our stay-at-home orders are businesses with 50 employees or less. The Fed will be releasing the results of their survey later on today for more details about their findings. The SBR program will total $2.5 million per county council district. This in total will be about $17.5 million, which represents about 10% of the CARES Act grant from the federal government to St. Louis County. This one-time grant program will provide up to $15,000 for eligible reimbursements per business. No one who is a director, an officer, or employee of a business who is an elected or appointed official of St. Louis County or any municipality in St. Louis County will be eligible to receive grant funding. In consideration on whether or not a grant should be awarded, we would also require that no business could be discriminated against based on race, creed, color, sexual orientation, gender identity, marital status, disability, or any other unlawful basis. A business is considered to be in good standing with St. Louis County if they are in compliance with our stay-at-home order, and there is no complaints of retaliation for anyone who reported anyone not being in compliance with our stay-at-home orders. A nonprofit organization that is a place of worship will not be excluded from receiving grant funds if they, for the sole reason that they are a place of worship. And they must comply for the other measures as well. The process for all of this, the goal of all of this with our SBR grants really is to focus on the businesses that have the most financial need in our community. And we believe that we need the help of our elected officials who are closest to these businesses, closest to the community, to help us make those judgments. So these grants will be awarded based on the recommendation of the council member from each district, but also recommendations of mayors, if appropriate, in any municipality that represents a business who has applied for one of these grants. Each county council member will summarize all of their recommendations by June 1st, and those will be reported to an independent accounting firm that we will identify, who will make a summary of these recommendations and will certify that they are in compliance with the grant programming. The accounting firm recommendations will be reported to the county executive's office through our process, and also to the county council's oversight committee. We'll also ask the county accounting firm, in addition to certifying compliance with our grant program, to also summarize any applications that were not recommended and any categories for which they were not recommended, any reasoning why. If the recommendations of each council district exceed the award amount, the total budget for these awards, then we will ask the accounting firm to adjust the applications appropriately to stay within budget. Also, any awards, any applications are all public information. All these applications are public documents. The process, the recommendations, and the applications will be reported on our transparency portal at stlcorona.com. We all recognize that we're really dealing with three crises here. We're dealing with our health crisis, our humanitarian crisis, and our economic crisis. We will remain focused on saving lives, but as we move forward, we want to start the process as quickly as possible to start getting some of these federal stimulus funds into the hands of our most affected businesses, as we've been helped with that identification through the Federal Reserve Bank of St. Louis, but also our local elected officials who are closer to each community. With the County Council's help, we believe that we can move over the month of May, by June 1st, be in process of moving $17.5 million of this federal stimulus grant into our community, into the businesses that have been affected the most. We hope to have more information regarding this up on our website this morning, stlcorona.com, and by the end of the day, we believe we can have an application up as well, so we can start this process in St. Louis County. And I'd be glad to answer any questions.
Real quick, you mentioned the $73 million for small business. I was given a question saying that really only 10% of that money was going to be allocated specifically for small business. Is some of this money going to go for testing?
Our primary focus with response has always been the public health piece. We've already had bids out for testing. Our testing supplies are improving. We have an enormous interest in selling testing supplies to St. Louis County, and we're going to continue that process. This is $17.5 million, is about 10% of the federal care grant award to St. Louis County.
And a follow-up to that question. People will be tested, but that doesn't necessarily mean from a month from now that they're not possibly going to catch the virus. So spending a large amount of money, of this money, on the testing at the point where everyone could possibly already have some sort of infection, is it necessarily good money after a bad situation?
I don't understand your question.
What I'm saying is, you can test today as if you don't have the virus, and tomorrow you catch it, or
Right.
the point I'm making is you're going to have to retest people multiple times over how long of a period? 6 months, a year?
Well, we would test anyone who develops symptoms. They would be tested. The St. Louis County will purchase tests and try and participate in that test. The federal government has indicated that insurance products should be paying for the test for people who have insurance. So St. Louis County will not be the only source of funding for tests in our community, but we need to buy testing supplies, and we need to be in this space along with everyone else. Our health systems, our federal qualified health centers, there are private labs who are providing testing. St. Louis County Department of Public Health is primarily responsible for following up on those test results, doing the contact tracing, advising people who've been exposed to someone who has a positive test, advising them on symptoms and quarantine, and also helping to advise anyone who's had a positive test on how they should take care of themselves.
So I'm looking at the timetable right here. It says that you're announcing it today, and then you're going to give the council members recommendation forms on the 15th, and then they have to turn in the forms by June 1st. And I imagine that if they turn in the forms on June 1st, there's going to be another period of time where we're going to have to review and decide whether to do this. Now, some people may say that's too long of a timeline, and that's not a speedy enough transmission to get businesses this money. What would you say to that this may not come in time to save some of these businesses from going out of business?
I would say that I've always said that this is an emergency, and that's why moving this money through the council is so important. They appropriated the funds 3 days ago, and we're announcing the program within 72 hours of that appropriation. We've been working on these details now for a couple of weeks. We've been talking about this for a couple of weeks since the Federal CARES Act was passed in Congress. I asked my staff immediately to look at what sort of relief we could have for small businesses, and this was one of the recommendations. I understand that there is a process and there is a timeline. This is about as fast as we can responsibly move to allow people to apply, to give the council members time to thoughtfully review these applications, to give mayors of cities to thoughtfully review these applications. I've always considered our municipal elected officials as part of our team that represents the interests of the residents in St. Louis County, and that's why I would like for them to be a part of this process. They're much closer to the businesses in their communities than we are here in St. Louis County government, and so are the council members. So there will be a timeline, there will be a process. The process has to be responsible and thoughtful and urgent, and we think this strikes the right balance.
And a follow-up question to that. After your administration decides whether to approve or deny certain businesses, it doesn't have to go to the council again to be approved. It would be, that decision would be made, and then businesses would either get the money or wouldn't get it.
Yeah, so, this is an emergency situation. So the process that I've advocated for, the process we see usually, certainly at the state level, the process that they have initiated is to appropriate the funds, put it in the proper place, and then start an urgent and responsible and transparent process to get it into the community that incorporates the opinions of everyone that should be involved in the decision. And that's what we're doing here. I certainly believe very strongly in the contributions of the council members. That's why I've asked them to be involved so deeply in this process. Taking it back to the council again would add more time, as you mentioned, and could also interfere with the arrival of this money into the hands of the people who need it. But that doesn't mean the council members or other elected officials aren't deeply ingrained in the decision-making of how we help people as quickly as possible.
Tim, what about this money in your mind or this program is so critical? Is this an important part of moving the economy forward when this gets going again, or what do you see as so critical here in this?
Well, the most important thing in getting our economy moving forward is a strong public health strategy that controls the spread of coronavirus in our community, because all of the economic impact on our region has been due to these measures that we had to initiate to save lives. And we always had an eye on the economic impact. We're watching it very closely. I've asked my staff to watch it very closely. And we believe that this will be meaningful. It won't solve all of the problems. There's still going to be stress in our region, but we've used our resources to identify the businesses that we believe are most stressed, businesses under 50 employees who were impacted by the stay-at-home order directly.
What about this do you find to be the most critical, just accessing the ability of these businesses to get funds, or what about this is so critical?
Well,
to
any
them?
business that has access to other federal relief programs would be ineligible for our programs. We're trying to get some funds in the hands of businesses that would be helpful. We will not solve all of their problems. We believe this will help some. What will help them as much as anything is controlling the spread of coronavirus in our community in a responsible way and creating the right environment for them to get open again with good social distancing guidelines so their employees do not become infected with coronavirus and their customers do not become infected when they visit these places of business.
So then, as you on another topic, your reaction to the change in course by Sean Flower out in Eureka not to reopen on Monday.
You know, that's that whole conversation is just an expression of the frustration of the stay-at-home orders, and it's expressed in many different ways in our community. And I think he's speaking up for his unique situation where he is, this represents a city that is in 2 counties and causes particular difficulties. I think everyone understands we have 88 municipalities in St. Louis County. The public health orders is a jurisdiction and a responsibility of county government. That's where that responsibility lies. There's a lot of reasons why individual businesses wouldn't want to go against that health order, and that's just the way it is. I think the most important thing is that we find a path forward. We focus less on our differences of opinion. We respect people who disagree with us. We come up with a way to get our businesses open again and to responsibly manage the spread of the COVID-19 virus in our community. Our role in county government is to protect the health and welfare of the residents of St. Louis County. We're going to stay focused on that, always watching the other pieces of this crisis, the humanitarian piece and the economic piece.
Clearly, I'm presuming that you think that was the right thing to do on his part, though.
Sure, it's the right thing to do to follow the county's stay-at-home orders, work with all of us in a cooperative way to try and get people back to work and to protect the health and safety of everyone in the county.
And finally, the Republican members in the council put out this reopening plan yesterday. You obviously met with them. Your thoughts on that proposal? Is there validity there? Is it too soon? What's your thoughts on that plan?
No, I think they had some good ideas. They're very similar to some of the things that we're doing. And I asked my staff to take their report and study the details and see if it would modify anything we're already doing. We certainly disagree on the timeline. They've expressed their timeline. Our timeline is different. We are different than the rest of the state. As I said before, we have the highest impact of COVID-19 in the state is right here in St. Louis County. We still have a lot of people who are very sick. We still have a lot of people in our hospitals.
Just to follow up to Chris's question, with the adjoining counties and the city,